also from a student standpoint, think about it, they are in theory, and instead of being in a classroom environment, they're actually experiencing something firsthand that we hope that they'll never see again, because this is again unthinkable. So Dr. Winter is an expert at this, and I'll let her speak a little bit.
It's a pleasure to be here. I have been amazed at this phenomenon with the health department, and they are incredibly dedicated individuals. People have been working around the clock for the last at least 2 weeks. None of us can remember what day it is anymore, and it's really outstanding. I think it's helpful for people to get a sense of what we're doing here, because we see a lot in the news, but you don't really get what are you doing day to day. In fact, even my husband says, what are you actually doing? And it's hard to break it down, but we're working very closely with the medical centers in the city, with the government, with the mayor's office, and we're contacting every single case that has come through. There's lots of suspect cases that are getting tested, and so we have to deal with that. And then anytime somebody is diagnosed as COVID, we're doing a very intensive contact investigation, trying to find out who exactly has potentially been exposed and putting those people in quarantine. There are quite a few people right now in Lexington that are currently on quarantine, and they are being actively monitored by the health department. We check in with them every single day to see if they're developing symptoms and see how they're doing. So we're working really hard to contain the spread as much as we can. I think a lot of people are familiar now with this concept of flattening the curve. What we're really trying to do with these mitigation and containment measures is we're trying to slow down the spread of this very aggressive disease. And we know with this virus now that it's about twice as contagious as flu. And because it's a novel virus, it's brand new, it's never infected humans before, everybody is susceptible to it. We don't expect that anybody has any sort of background immunity at all. So when it gets into a population, it can just spread explosively. Imagine a wildfire, with all this kindling. And so that's essentially what we want to avoid. What we want to try to do is have it, if it does spread, that it goes slowly, that we have this kind of trickle or stream and not this explosion of new cases, because people cannot get the medical care they will need if we have an explosion of cases. It will overburden the healthcare system. And so that's really what our number one goal is with the health department right now. And we are working very closely with the medical providers every single day. And they are working very hard too, so that we're not the only ones. But it's just incredible to see this community coming together, and there's great communication and really excellent leadership. So I feel very proud to be a part of this response.
Yeah, and Richard, I guess, what questions do you have for us, or do you want us to talk a little bit overall about COVID? How do you want to approach this?
Yeah. Do you all want to talk a little bit more about COVID itself and what steps have been taken to make the public safer? And then we'll open it up maybe for some questions from the folks on the call.
Yeah, and one thing before we get into that too, I want, I guess I can see a few of you on here, but if you just want to have it at your homes, how many show of hands have seen information comparing this to the flu and heard people say that, oh, the flu is worse than this? I mean, it's every one of us. But you just heard Dr. Winter say that it's worse than the flu. And if no other reason, and she can address all the medical sides of this, but there's a vaccine for the flu, and we know how to treat it. We have medicines that we can take on this, and we've been exposed to it. It is something that is completely known. Mm-hmm. And this is more deadly. It is showing the mortality rate is higher. It is easier to catch. It's more contagious. I'm speaking in her lane right now, so I'll let her have that. But from a communication standpoint, that's the battle that we have, is we have misinformation from all of these Facebook epidemiologists who don't need to be sharing information because they're wrong. They are flat out wrong.
Well, there are some Facebook epidemiologists that are right.
There are actual epidemiologists who are right. I
have a number of epidemiology friends.
There's some who are watching, I'm sure.
Who are posting really great, excellent things.
Yes, but the one, it's the quote marks around the word epidemiologist there, because they're just sharing memes and bad information from bad sites. And there's conflicting information from different organizations, and that's why we go, again, CDC. Almost everything that you'll hear the health department talk about comes from the CDC. The information that's not CDC, we get sourced from the governor, who is getting that from the state health department, and Dr. Stephen Stack, who are getting it from the CDC. We're on phone calls with the CDC daily. We're on phone calls with the state daily. We talk to the mayor daily. I can't imagine how many times we're talking to the hospitals and medical providers. So that's just a broad stroke of it. But COVID itself, I'm going to let Dr. Winter talk about that and what people need to know from it.
Sure. So COVID emerged in, we think probably Wuhan, China in December 2019. And I think a lot of people are familiar now with that story about how these viruses exist in animal reservoirs all the time. So they're coronaviruses, there's a whole family of them. And there's actually 4 coronaviruses that regularly infect humans, and they cause the common cold. And most of us have had them. So, it's not like having a coronavirus is in itself a dangerous thing. There have been 2 other coronaviruses that we know of that jumped from animals to humans, and one was SARS and one was MERS, and both were very severe diseases. This seems to be very distinct from both of those diseases in a few ways. So one, it seems that there may be more asymptomatic disease with this coronavirus, with COVID, which is good and bad. So it's good that maybe it's not as severe for everybody, but it's bad because then it gets spread more easily because we're not identifying all the cases. So with SARS, the typical course when someone was infected is they got very sick very quickly. And so we don't see that, we're not seeing that as much with COVID. It seems that people kind of start out with some sort of non-specific malaise and aches and fever, cough, which a lot of things cause that, so you wouldn't necessarily be concerned. But then it can progress into an aggressive viral pneumonia. And I've gotten this question a lot. People say, well, I've been vaccinated against pneumonia, so doesn't that protect me? But the answer is no. That is good that you're vaccinated against pneumonia. I'm happy to hear that. And it actually could protect against the bacterial pneumonia that you are vaccinated against, but this is a viral pneumonia, so it's a different cause. So, that is part of why we are really concerned about this, because we know that it can be aggressive, and we know some people will have a very difficult time. So the information is changing quickly because there's so much we still don't know about this virus. And most of the studies that we have are coming from the early reports in China and now from Italy, where there's been another massive outbreak. And I think a lot of people are familiar with what's happening there with the just overburden of the healthcare system and people really being critically ill and not having access to the care that they need. So I think the Italy story is exactly why we have been so aggressive here. I think Kentucky is being more aggressive than most other states, and I'm very proud of that. I think that's an excellent thing. So I'm hopeful that our early aggressive social distancing measures, closing schools when we did, canceling public events when we did, trying to get on top of this as quickly as possible. The studies have shown that, look at social distancing, that if you do it aggressively and you do it early, it can really make a difference. And so we're hoping that that is absolutely the case here.
Yeah, and that's been our message, is initially it started with the high-risk groups, the people who are over 60, to make sure that they were staying home, and also the people with chronic health conditions. So anyone with diabetes, cancer, compromised immune systems, or heart, kidney, and lung disease. Mm-hmm. So making sure they were staying home. That's still the recommendation, but now obviously it's expanded to everyone stay home as much as possible. And it's been a challenge because what happened on the day the first case hit in Kentucky, March 6th, that weekend, things were changing, and the messaging continues to change to where we are now, where it's everyone stay inside as much as possible if you don't have to. It's also very important for the people who are watching this, whether it's live or in the future, tomorrow or the next day when it's on the website and social media, is we don't want you to just go to your medical provider. Don't come to the health department if you're sick, because you need to call somewhere first. First of all, the health department does not offer primary care medical services, so we wouldn't be able to help you in that sense. We also don't have testing here. We do not have testing at the health department. You don't want to just show up at your medical provider because you don't want to, one, you don't know what they are able, if they're able to test there, and you don't want to overburden them. You don't want to risk exposing people to this. They have steps in place if there is a person who is symptomatic and has potentially been exposed. So call your provider first. If you think that you need to be tested, you should call, a lot of people are calling their health provider, a lot of people are calling the health department, but the recommendation has been to call the state hotline. Is that right? They're calling the state hotline. The state triages that and they work through some information and then make the recommendations. But again, don't just show up someplace. Don't show up at a little clinic. Don't show up at urgent treatment. Do not show up at the emergency room. These places cannot handle that and don't need to risk that exposure.
If you really, so the advice we're giving people, because testing here is very limited, is that if you are sick, you should stay home. Stay home and take care of yourself. And if you have other people in your household, try to stay away from them as much as possible. Now, if you feel like you are very ill and you need to be seen by a medical provider, then you should try to do that, but do it in the ways that Kevin just described. Don't just walk into your provider office or an urgent care if you're potentially carrying this virus and exposing people. We have had a lot of healthcare workers in Lexington who have been exposed to this virus because people who are sick came into the offices. And what's even more difficult about the testing, and there's lots and lots of misinformation out there about the testing. So it's such an important thing that people understand what the reality is. We do not have very much capacity for testing yet in this state. Their state does not have a lot of test kits and commercial labs are coming on. So there's more and more capacity. However, it's not just about the test kits. There's other pieces that are really important. You need to have the right specimen collection tools in order to collect the specimen. The swab that's used is not one that all providers have in their offices. And the other piece that's even most important is that the provider needs to have the right kind of protective equipment on. So if they are not wearing the proper mask, the proper eye protection, gloves and gown, they are at risk and they can get this virus. So we don't want people trying to seek testing just because they really want to know if they've got it. We understand that desire. We understand your concern about your health and your family. We are not insensitive to that at all. The reality is that you cannot all get tested right now. That's just not something that can happen. And so we're trying to protect our healthcare workers as much as possible.
Richard, I see some people have some questions. Do we want to go ahead and tackle some of those, or do you have some for us?
Yeah, let's go ahead and jump into these questions. I did want to just provide the phone number for the hotline is in the chat feature, but it's 1-800-722-5725, just for everyone out there. So this is a question from Scott Fitzpatrick. Can you tell us about the interview process, which helps identify the individuals who may have been in contact with someone diagnosed with COVID-19?
Sure. So the way the process works now is the testing results. So when we have a positive case, if that information comes to us from the state health department or directly from the commercial lab. Occasionally we'll get a call from a hospital and they got it first, but usually it comes from the hospital or the state or the lab. So we will initiate a case investigation at that point and we will contact the patient. If the patient can't be reached or they're hospitalized or there's something complicated about what's happening with them, then we'll talk to a family member and we will find somebody. We are epidemiologists, are disease detectives. So we're good at tracking people down. We know how to use the internet to our advantage and we are aggressive. We don't stop till we get what we want. So we will talk to the person. We will find out every place they went the 2 days before they started getting sick, through the point to which we are talking to them. We want to know everywhere they have been. We want to know who was with them. We want to know how long they were in those spaces, who did they talk to, and then we start this process of assessing risk exposure. So if somebody's in the household with that person, they are a high risk contact. We put them in quarantine and we do the monitoring. If somebody say, is a friend and they stopped in and they chatted for a few minutes at their house, then maybe we would consider that something like a medium risk exposure. So there's different levels of risk. We're following guidance from CDC. We're using our best judgment and expertise in trying to figure this out. So it's really based on what the case tells us. You know, the person who has coronavirus, how much they remember. We try to prompt them, look through your phone, look at your calendar. Do you remember everything that you did? And so that's the process. And then we get those phone numbers for the contacts, and we do basically the same thing to try to reach them as well.
And it's really fascinating from somebody on the outside like me. Again, I work in communications, so I've not been trained in the epidemiology part of this. And to see how that works, I always compare it to, we think that we know how police investigations work or the legal system works or journalism newsrooms work because we see those things on TV. But there's not been an epidemiology a popular program about disease investigation.
There will be now.
There will be.
Now.
That's coming.
I'm making
That's,
it.
I'm writing that script in my spare time. But it is like police work. They are the disease detectives because they're starting with the person and building that circle, and they're asking the questions, and there's not good epidemiology, bad epidemiology. They don't have the good cop, bad cop thing. It's not like that. But it really is. It's a great question, and I'm glad somebody asked that because the public for them to have a better understanding of how that works really goes a long way into, because you hear the people saying, well, why aren't you telling us immediately any more information about it? Well, when there's a crime committed somewhere, are police telling you immediately all the information you need to know about it? No, there's an investigation to find that out, and these people need the time to work it and to make sure that people are protected while maintaining all the privacy laws that are in place as well.
Awesome, great. The next, I almost dropped something. The next question is from Bobby Newman. And the question is, the recent directive to only get takeout or delivery from restaurants. How is the public assured that those preparing the food aren't contaminating the takeout and inadvertently spreading the virus?
That's a great question. A lot of people have been asking that question. So the way that this virus is spread is not wholly unknown, but we do think that the risk of transmission through food, through touching of fomite transmission is probably pretty small. That's not the primary mode. We can tell based on the epidemiology and based on what we see with these investigations and all the reports previously that it's really close contact. That seems to be the primary thing, and potentially some airborne transmission. So, if it were me, I would feel very safe ordering food. In fact, we have been here at the health department. We order in dinner every night because we're all here till 9 o'clock. Or later. So that's not something that I am worried about. If it is something that you're concerned about, you could consider this. You could order something that's cooked because we know that heating can kill this virus. So that might make you feel more reassured. If you want to be extra cautious, you can put it onto a separate plate and then you can zap it again, wash your hands, and you should feel pretty safe with what you've done.
And another piece to that that's not directly tied to the COVID part of that question, but I still would like to remind those watching that our restaurant inspections from the health department are continuing throughout this. So any restaurant that is serving food is still getting inspected. And we do that at least twice a year. So if they're on the schedule to get inspected, they will be, because the one thing we don't want to have happen on top of COVID is to have a foodborne illness outbreak. And so if you're ordering from someplace in Lexington, anywhere in the Kentucky, those are still being inspected. So that isn't directly what you were asking, but it does tie into that. I'd like to just jump in, though, if I could ask a question of Dr. Winter that's a piece of what the previous question.
Sure.
That's okay. What I get hit with a lot from my friends, and I don't have a great answer to them because I'm not the expert epidemiologist, is what about the people who are preparing food they go out to emergency shelters or for our homebound residents? Are they at risk of potentially spreading that and getting into those homes?
I mean, you touched on it when you said we're doing regular inspections still. If you're practicing proper food handling practices, adhering to the normal protocols, wearing gloves when you're touching food directly, it should be very safe. I'm not worried about those transmissions.
Great. So now I would like to open it up. If anyone has a question, I've muted you all and I cannot unmute you. You have to unmute yourself. So if you have a question or would like to ask something, go ahead and unmute yourself and let's hear from you.
So this is Scott. If I could ask another question.
Sure.
You had mentioned that earlier that there were a number of people in Lexington that are under quarantine because they, through the interview process, they're identified as having come in contact. Can you tell us about how many of those people are? Because at this point, the number of confirmed cases in Fayette remains relatively low. Hopefully it stays low. We know it probably won't. But how many folks has it been determined that may have been in contact?
I can't say the number with certainty, but it just depends on people's social behaviors and how many healthcare providers they visited before they ultimately got tested. So we've had, like I said, a number of healthcare exposures, but it varies. So some people have had very few and others have had a lot. And we're doing our best with it.
And it's the biggest reason why you're seeing it now for people to do the social distancing and to stay at home. Because if you ask me who all have I interacted with in the last 2 days, that'd be very difficult. Now, it's not as difficult now that we're staying home, but that goes a long way toward helping. Mm-hmm. So not only to reduce the spread, but it helps if somebody were to be able to be part of this case investigation. It helps be able to track that easier as well.
And we do know this virus can be spread when you don't have symptoms. That is a fact. There's a number of studies that have shown that now. So that's a concern for people because they're concerned they could be spreading it. So that's even more reason why if we all hunker down the best we can and limit our social network, people still have to have, many people still have to have childcare, many people still need to work. So we're trying our best in my household because I'm coming to work every day. My husband's going to try to stay with my kids, and we're limiting our social network outside of that because we don't want there to be any risk, and I don't want to get sick, and I don't want to expose all of my colleagues here. We're trying to social distance at the health department as much as we can. In fact, Kevin and I talked about it.
We're violating it right now so we can fit in. There's a very small space in this, but we have taken steps at the health department. Today, we launched our first digital town hall phone call to be able to communicate with staff, because before you just bring everybody together and you have in a conference room and talk to 50 or 60 people at once. But now we're using the technology that's available to us to do that. Working with CivicLex to do an online digital town hall to talk directly to you. We've rearranged our conference rooms so that they're probably 10 to 15 apart. The chairs are now to really avoid that close contact. And we encourage other places to do that. So if you work at a place or into your own business or wherever you work, talk to the people in charge or take it upon yourself to institute these changes if it's at all possible.
Great. Yeah, I can imagine that's you can hear my dog barking in the background.
Well, you did
Sorry.
The Facebook post that we would probably.
I did say that my dog it's the joys of working from home, right? Does anyone else have a question? Just unmute yourself and weigh in.
I have a question. This is Liz.
Hi, Liz.
One of the things that we've seen in other places is a lack of supplies at like our medical settings, like gloves and face masks and things like that. I saw an article that we recently got a delivery of supplies, but how does that look in our medical setting? Is there a shortage or concern about a shortage?
Well, we have been working, as you saw in the article, it was the Herald Leader or the Kentucky.com article that talked about the health department and the emergency preparedness response. And it's to make sure that they are trying to get that information and that PPE to the people who need it the most. I can't speak on if there is a shortage or where those needs are.
Well, let's put it this way. There's a shortage of toilet paper, so you can imagine that there may not be the best supply of other protective equipment, right? So people who've gone out, the public has bought up what there is to have. There are no more thermometers we can find here in Lexington. So, there's people do react. And so, we are working with the healthcare facilities to find out what they think their needs are, and we will meet them the best we can.
And I know that I can't speak on behalf of the hospitals and what they have, but I've had friends who work in other long-term care facilities or things like that, and they have reached out to say, do you know where we can get more equipment? So there are people who need it, and some of that's because the worried well in the public are snatching things up. So you've heard us say, you've heard other people say, you don't need masks, don't go buy masks. Now that doesn't apply for everyone. If you have a compromised immune system or an underlying condition, we don't want you to say that, well, I'm getting chemotherapy, I don't need to wear this mask anymore. That's not who we're talking to. We're talking to the otherwise healthy people out there. The mask is going to offer very little, if any, help to you. Don't take those away from the people who need it. It's the same thing with people who are ripping hand sanitizer off the walls at the hospitals. You are taking that away from your healthcare workers or the people who are in the hospital who need that. So let's try to be mindful. Let's try to truly be the community that Lexington really is to help protect everyone.
We talk a lot about being good stewards of our equipment. So everyone would love to have the best supply possible, but we're trying to prioritize based on what the needs are for patient care and what the needs are for the facility. So it's actually a pretty involved process, but the health department's doing a great job working with their partners.
Great. People are ripping hand sanitizer off the walls at the hospital.
Yeah, it is. I know of at least one hospital where that's happened, I think in another county, but you hear about it where they're stealing gloves. And they're having to put warnings in that because people would walk down the hallways and steal the gloves off the wall, or they would take a box of masks. Yes. We make sure that in the health department that the health sanitizer is available for our employees, but we keep an eye to make sure that it's not disappearing because our employees need to be protected. They are the public health workers responding to this.
Yeah.
So we had another written question come in.
Yeah, we have two more questions. This is from Christina. Are there resources out there for people who have tested positive and are in isolation at home, such as medicine, food, incidentals, etc.?
That's a great question. And I know that's something that the Mayor Gordon and the city of Lexington have really been working on, not only for the people who are in isolation, but anyone in Lexington who is being affected by this. So I would really encourage you to go to the city of Lexington's website. I apologize that I don't have that one memorized, but if you go to their site, I think it's cityoFlexington.gov.
LexingtonKY.gov.
Yes, there you go. And they have, I look for the COVID-19 link, and they've got a list of resources. Because it's people who are banding together to make sure that people are protected. I think, Dr. Winter, were you going to speak? Did you have anything more to add on that?
No, that's good.
Great. Here's another question from Lisa. I live downtown on Main Street, and right now seeing a fair amount of car and bus traffic as well as pedestrians. I can also see 3 surface lots with a surprising number of cars. Is what I'm seeing square with the urgency of the situation and best advice? What more can and should the city or state do?
So to understand the question, I'm hearing that as, are people getting out too much? Is that what the way you're understanding that? Well, one, it could be that the people it could be health officials who are going out and working. It could be the people who are working some of the city services. Lexington has a large population of medical providers. I think that's one of the largest in the country per capita of medical providers. So those people are still going to work. You still have your fire, your police, and those emergency officials. And there's some businesses that just can't shut down and have it. And there's other businesses who are going to skirt it as long as they can. You saw yesterday the governor was calling out places individually because they are violating his mandate. What we are telling people is that, again, if you can stay home, stay home. If you're a business and you're unsure what you should do, go to the CDC website because there are those guidelines on there. The health department is not providing recommendations. We can't. We just simply can't tell you if you should or shouldn't close unless you're one of the places that the governor has listed that is required to close. If you see someplace and you're unsure if they should be open, I know the governor said call that hotline and to ask questions, or if you need to report a place that is violating that. And from the governor on down, we're very serious about this because if somebody has been ordered to not open their doors and they're violating that, you're putting all of us at risk. And it's infuriating from a public health standpoint to see these beaches in Florida that are still open and in Texas that are still open, and as these kids get on the airplanes and come back and start spreading it, bringing whatever they have with them into the communities. Because I know all of the work that these people are doing, We have people in this department who haven't seen their families since March 6th, and they're doing that to protect your families. And it's really, really, really difficult to be able to come in day after day after day and do this and think people aren't taking it seriously. Fortunately, in Lexington, there has been a great response from the government. The governor, Bashir, has been fantastic about being out in front of this, and we hope people are listening. And if it's people like you watching this who are showing an interest in it, that are really going to help get this taken care of sooner rather than later.
And I think it's good to remember that we want you to stay socially distant, but that doesn't mean you have to stay in your house or in your home at all times. In fact, being outdoors and taking walks is a really outstanding way to be socially distant. Just walk alone or walk separated, 6 feet away from somebody. I've been, when I finally do get home, walking in the evening, and I can't believe how many people are out, even the days that it's rainy and cold. I think it's kind of a new way that we're experiencing this city, and you can sort of see it in people's faces that there's a heaviness. This is an intense experience for everybody, and some people are already in very fragile situations medically or financially, and so it's very scary. So we are trying to be sensitive to all of that and doing our best. One thing I wanted to point out, because I've been impressed by this, is I've noticed a lot of neighbors stepping up to help neighbors just on social media and just even around me. And, people putting notes on other people's doors and writing things on the sidewalk. And one neighbor who just was, kind of walking around just trying to wave to people because, they think that there's a need for community and to remember that we're all in this together, even if we can't see each other and we can't talk to each other face to face for, the ways we normally would. But we're still a community, and we're working hard to protect it.
Yeah, Dr. Winter makes a great point too about it's staying in, but it doesn't necessarily mean staying inside your house all day. I had some friends who I saw post on Facebook that she and her husband got in the car, went and got takeout, went through the carry-out service, went and parked and watched the sunset. And they talked. I don't think they'd ever done that. And it was a date night for them. And it is an interesting way now to try. It's not making lemonade out of this bad situation. It really is just take this to look at a new experience of Lexington and Kentucky. This is a beautiful state. It's a beautiful city. So take those walks. Maybe go into a different, instead of the left turn that you normally take that right turn to see a different part of the city and get out. The other benefit of getting out is, two benefits. You have your physical health. We want people to stay physically active in this because the better shape you are in, the more fitness that you're getting, the better off you're going to be in the long run as well. But it's also the mental health aspects of it. And I think some of the weather the last few days has been really dreary, rainy, and it's affecting people. I see people on social media, we've talked about it in here, it can drag you down. So just getting out, even if it's just getting that umbrella, getting some of that fresh air, it is good. It is really good for the mental health as well.
And it's harder to spread disease when you are outdoor in fresh air. You will not have the same rate of transmission.
That's great. Does anyone else have any questions? You're welcome to put it in the chat, or if you want to unmute yourself, you can weigh in person. Well, digitally in person.
Just please tell me that Kentucky football season will happen.
Not answer that question.
The more people stay in and the more people practice what we're
There we
putting
go.
about public health, the better chances that something like that will happen. But yeah, it is, but it's we all get a good laugh about it. For me, that was when it was really, I saw that it was hitting home with them. They weren't believing how serious this was until the NCAA tournament got called off. And it was, oh, wait a minute. And if you're taking away college basketball in Lexington, Kentucky, you're getting people's attention. And the Derby. And the Derby now is the huge, and we applaud the people who made those decisions. The Derby would have been an actual public health nightmare with this. And you're talking about millions upon millions, if not billions of dollars. Those weren't easy decisions, but they were the right decisions to make. And if I could say one thing too, if you don't follow us on Facebook, follow us. It's facebook.com/LFCHD, because we need your help. The more that you are able to share with the people you know about this information, we have flyers that talk about social distancing. We have information about COVID, and it's not all going to be COVID related. We've got other materials on there to help people with their public health and their health issues. So it will go a long way toward helping educate the public. We would really appreciate that.
Great. One last opportunity for anyone from the audience here to weigh in. All you have to do is unmute yourself or type in the chat. All right, great. Well, thank you all so much for doing this. This is our first one, so we appreciate both of you all for doing this, as well as thank everyone that jumped on for doing this kind of unorthodox thing. It was nice to see some people's faces trickle in. We're gonna try and do this again next week. Maybe not with you all, or maybe we'll do one with you all and one with some other folks. So thank you all so much, and we appreciate your time.
All right, thanks a lot.
Thank you.
Thank you.